Hello, my name is Jeff Fole. I'm the CEO of a new startup company called Stratis Bio. This company is based on a natural product formulation I developed for my wife for her CRPS, which is complex regional pain syndrome, the most painful disease known to man. And based on pain research that I'd done in pharma and biotech, I was able to put together a natural product formulation that worked pretty well. We've advanced that formulation. I'm going to take you right now through just a little bit of the data. It's kind of a teaser, and then we can go further if you're interested. So what I'm going to take you through today um, is just really a review of what CRPS is, some examples that we have that are kind of representative, and then other chronic pain diseases we've tried. Talk a bit about our addiction formula as well. So the CRPS, it is the worst case scenario of pain, and basically what it is uncontrolled inflammatory response going into a limb that was typically injured. So you have pain that increases from inflammation, which then cycles back and gives you more and more inflammation. So it's completely uncontrolled, very, very difficult. Typically, people that have this disease are living somewhere in the 7 to 10 range with pain all the time, nonstop. It's likened to having an amputation without anesthesia. And here we see one person has it in their foot, and the inflammation here's in the hand. And tragically as well, that the CRPS, even though it may start in a foot, it can travel through the body. And some folks we're working with have whole body CRPS. Plenty of other symptoms come with it, from lack of hair growth down to pins and needles to the gastric system not working, just a great variety, brain fog, blurred vision. So a lot of symptoms that can come with the disease. So it's clearly systemic. It's so difficult as a disease because typically 10 to 30% might respond to a standard of care partially for pain. And so most of these folks literally have a prognosis of living the rest of their life in great pain without much help. And so based on that, they say 70% or so actually contemplate suicide, go through suicidal ideation. 5 to 14% attempt suicide with this disease. That translates to about 7 people every day in the US right now from this disease. Two types, basically. Type 1 is based on an injury, maybe cut your hand or something like that. Type 2 is based on nerve damage, no nerve damage, where a surgery or something, they nicked a nerve. Occasionally, it can start on its own, and they don't know why. So here we're looking at Danielle. Danielle has two diseases going on. She has EDS, Ehlers-Danlos syndrome, which is a connective tissue disease. She has swelling in her foot from continual joint dislocation. And then here is your classic CRPS, the red and the inflammation. And what was remarkable as she began to take this product in different variations of the product, she was the first one testing, we see a great reduction in inflammation 41 days out, and then about back to normal at 60 days. And that's with plenty of days missed where she didn't have the product. When she started this process out, she had 2 points of CRPS in her ribs and spine from an accident back in 2004, and then in her foot from surgery at the beginning of the year. And so she was at a 7 to 9 in her pain, and now she's down to about a 1. So really fantastic reduction in pain. And we're seeing similar results like that with many people. Some don't get quite down to a 1, but we're seeing at this point, it's greater than 85% of people that take this product with CRPS are seeing very powerful results. And we're up to almost, I think, 25 people. Allodynia is a horrible symptom of the problem of the disease. It's a hypersensitivity to touch. So a very light touch that normally wouldn't do anything gives you a significant pain signal. And for example, here with that foot, we look at the red area of her leg. That's where she had allodynia. If you were to press your finger there, it would feel like someone putting a cigarette out on her leg. And we were very, very surprised and happy to see that the area of allodynia completely reduced over time. And now she's down just to primarily her large toe metatarsal. And so, we're seeing that as well with other CRPS patients, that the area of allodynia is greatly reduced. Here's an example of her EDS, Ehlers-Danlos syndrome. This is her knee, which she dislocated as she was working. Typically for her, it would take 4 to 6 weeks being immobilized. She would be in a chair and have a brace put on it. And here now we're looking at 8 days with the product, and she was ambulatory. She was able to do everything she normally did. She just K-taped and braced her knee. And so the anti-inflammatory effects are really, really powerful. And then here we have Karen. Karen has type 2, which is based on a nerve, as we mentioned before. And you can see the incredible inflammation that's going on in her chest, perhaps mast cell erythema, and with stress. And she took this product within 1 hour. That began to resolve. And by the next morning, 9 to 12 hours, that was gone. She's never seen anything like this. And I think we're just really amazed at the anti-inflammatory impact of the product. When she started with this, her pain was a level of 6 to 8. Now she's down to around 2 to 4. Karen has gastroparesis, so she is not able to take it in liquid format. She's taking it in capsule format. So we're seeing good response, maybe not as good as the liquid format. So Kim has type 2 and very regularly working and on her feet. When she started before treatment, she was at a pain of 7 to 8. Now she's down to a 1 to 3, very manageable. And here we can take a look at the swelling in her right foot, classic CRPS. Within an hour, it's beginning to alleviate. Within 24 hours, it's getting back to normal. So again, this anti-inflammatory effect, I think it all ties together with the pain as well. As you knock down inflammation, you're going to be knocking down pain signals. So Kim had quite a few of those symptoms I was telling you about: tremors, brain fog, nail changes, no growing of the nail, allodynia, sweating, asymmetry, just a wide variety of classic symptoms that you can get with this disease. After day 6, taking the product once a day for 6 days, most of those symptoms were gone. And we're seeing this consistently with CRPS patients, that many of their symptoms are alleviated as they take the product over time. And then Chloe is a sweet young lady. She was 12 years old when she first got it. There's no known reason how she got it. We don't know. She just was running in PE, and her feet all of a sudden felt like they were running on dry ice. And so here we're seeing the inflammation in her right leg and some in her left leg. You can see her foot, the discoloration. Pain level that she was at a 6. She would be in a wheelchair if she had a flare up or needed to do certain things. This is 5 days now on the Stratis Bio product, just a complete change in the coloration, the pain levels, etc. At day 7 with supplementation, she's down to about a 0.5. So she saw a little bit of reduction in the first day, and now she's down to a 0.5. And actually, we've seen 0.0 with her. And so we've tested this product with a wide variety of pain modalities besides CRPS, and we're looking at pain reduction and as well as elimination of opioids or opioid reduction. And so with CRPS, we just talked about, we have 87% responding well, up to 100% pain relief now, and up to total elimination of opioids. We have a back surgery patient that got great pain relief with it, but was still taking 5 MMEs of opioids. They had a spinal stimulator to deal with that pain, and the product would keep them from needing to take a rescue dose. Degenerative disc stenosis pain, exactly identical to the Vicodin protocol, 50 to 65% pain relief, complete elimination of opioid. And this is what's really exciting somewhat about this product, is that about 70% of people are able to completely eliminate their opioid use in 1 to 7 days, 1 to 7 days. And so we know that prescription opioids is the gateway to the addiction. So this sounds like a possibility of using this product instead of opioids and shutting down some of that addiction development. Kyphosis pain, 80% pain relief. Again, complete elimination of opioid neuropathy from a scoliosis fusion, 100% pain relief, and elimination of opioids. We saw the EDS with Danielle. We had impacted tooth, 75% pain relief in impacted tooth. That's quite interesting. Lupus, an individual with lupus saw 60% pain relief within 10 minutes, which is really, really quick. And I'd love to see what gets into the bloodstream there, what molecules are driving that. That'll lead us to the targets that are driving the pain. Greater than 85% pain relief within an hour. This individual is becoming somewhat resistant to the product. And we've actually seen that with one other person with CRPS that it began to work, but it's not working anymore. We have a broken vertebrae compression fracture, a 66% pain relief. No opioids were used here. Fibromyalgia and autoimmune. We got more than one case of fibromyalgia, great pain relief. In this case, no opioids were used. And here we have a crushed vertebrae from a wreck. Using our product was equivalent to the hydrocodone protocol that she was on. And so therefore, she was able to eliminate opioids completely. We see greater than 50% pain relief with arthritis in multiple cases. Gout was greater than 70% relief, which is, and gout's really difficult in the foot. And then we saw an individual use our product early on back in 2017. It wasn't the formulation we have now, but it was an earlier formulation. And she was taking heroin upwards of 3 to 5 times a day. And she was able to reduce her heroin usage by 80% just using our product instead of heroin. And so based on these data and the opioid, we actually developed and modified this formulation for addiction specifically. And we were able to get an individual off of methadone in 2 weeks and 4 days. They had been trying to quit methadone for over a decade. So that was exciting. And then we have another individual that was addicted to kratom, taking the feel-free drink 6 to 10. And within a week, that was completely taken care of. So in summary, I think we may have an incredible breakthrough for CRPS, which is really a horrible disease, but chronic pain as well, any form of chronic pain, and then addiction. If we're able to substitute this product out for opioids and it's not addictive, then we're going to start slowing down the pipeline, the pathway into addiction. And we need collaborators to execute this effectively. And we need funding to execute effectively. So I have a call coming in. Apologize about that. So we have collaborators that we need to effectively stop sharing. See if I can turn that off. There we go. So we have collaborators that we need. We'd like to do some animal studies, try to understand how things are going on. Perhaps folks that can do some human studies as well. We have a DO that's coming aboard so we can put together an IRB. None of these data are collected under an IRB. And so we need to do that. And then we need funding to execute effectively and manufacture and distribute. So if you'd like to donate to the cause, you can do that with Venmo at Stratis Bio, at Stratis Bio, STRATISBIO, or Zelle at 813-358-8588. And if you'd like to collaborate or get involved in investing, you can email me at jpfohl_stratisbio at proton.me. So jpfohl_stratisbio at proton.me. Thank you for your time. Looking forward to getting to know folks and seeing this product out in the field as soon as possible.